Welcome back to the world of infectious disease, particularly right now, the discussion about viruses. So we just talked about hand washing versus hand sanitizer. We touched upon that. And then I explained to you a little bit about what viruses do in your body. Basically, they multiply inside of a particular part of the body. The multiplication causes a volume change in that part of your body, filling up with particles and white blood cells. That causes its own set of problems, and you get sick. And that's what it boils down to. Many of the illnesses that we have are in some way, shape, or form connected to this concept of inflammation. But for today, we're going to talk about what are the most common viruses, particularly the most common respiratory viruses. And I can tell you right now, every single one of you watching this video right now should be able to tell me the most common respiratory virus, because you've probably had this infection. Yes, you have. So the most common respiratory infection is the common cold. The common cold. I know that in Spanish, here I'm in California, you've got to speak a little bit of Spanish if you want to be able to see patients, because we have a lot of Spanish-speaking patients. In Spanish, we refer to it as gripa, but the common cold is the most common infection, respiratory infection. Now, why do you think they call it a cold? It's not rocket science, but the reason why we call it the common cold is because you usually get it when it's cold. I suppose you could get a cold when it's hot, but you don't. It's usually in the wintertime. That's when millions of people around the world, whether in the northern or southern hemisphere, that's when you get it. You get it in the wintertime, or you get it during the cold season of your land. Here in America right now, and in the northern hemisphere, which does include China, Italy, South Korea, these are all in the northern hemisphere, they're currently dealing with some very serious infections. The infection that they're dealing with is the coronavirus. But today, I'm going to talk to you about the most common respiratory virus, the rhinovirus. Rhino, meaning nose, virus, the nose virus. So we learned that the viruses that infect people usually have an inner DNA or RNA surrounded by some sort of a protein layer, which we refer to as the capsid, and in some cases surrounded by a lipid envelope, which we talked about, the phospholipid bilayer. Rhinoviruses have RNA inside them. They have a protein outer layer or capsid, but rhinoviruses do not have a third lipid bilayer. So they don't have that third layer. Rhinoviruses have an icosahedral shape. Icosahedral shape. That means it originates from the Greek language, and it means 20 faces. They kind of look like this, a bunch of triangles organized in a shape. Okay, and that's the general structure of a rhinovirus. Inside of this icosahedral structure will be some piece of RNA, because that's what is inside of the rhinovirus. Okay. How big is the average rhinovirus? Well, rhinoviruses are very small. They're usually only about 30 nanometers. This is going to become very significant in the next couple of videos when I talk about the N95 mask and other masks that you can use to potentially protect yourself, or masks that you might inappropriately use that don't protect you at all. Because the rhinovirus is so small, it's very easy for this virus, 30 nanometers. Again, I'll explain that to you when I actually have a mask in my hand and I can kind of show you the differences between particle sizes and things like that. I got to get through all these viruses first. But the rhinovirus is very, very small, and it can pretty much get anywhere. If you cough, if you sneeze, if you touch something, and then after you touch that thing, you touch your face or you rub your eyes, you have just transferred that rhinovirus, which could land on this little arm here of this chair and probably stay active on that chair. So let's say somebody with a cold sat down in this chair before I did, and they rubbed their nose and then touched the armrest right here. The big question, and everybody wants to know this, is how many minutes or hours or days is that virus going to be able to stay there, and then somebody can come along, touch the armrest, and get sick from it if they rub their face. Well, the sad reality of it is that for the rhinovirus, it's a very long time, many hours, even several days in some cases. There's over 100, 200 different types of rhinovirus. They are all over the world. We want to say almost essentially ubiquitous, which means you can find them almost everywhere. And if I were to touch this armrest immediately after someone, immediately means 5 minutes, 10 minutes, 1 hour, 2 hours, 3 hours after a sick person touched it, and then I were to touch my face, particularly my nose, I'm basically taking the virus from this armrest and putting it into my nose, and it's a rhinovirus. So I'm putting the virus right where it wants to be so that it can then enter into the cells of my nose, start multiplying and causing problems in my nose, where we know inflammation causes that area to swell, and then the mucus, and then everything. Good news is that the rhinovirus infections usually only last a couple days, maybe up to a week, depending on the person. You start off with symptoms, and you know these symptoms because you've had these symptoms. For me personally, I'll just tell you, last time I had a cold, I think was 2018. I do a lot of things to try to prevent myself from getting sick. So it's been about a couple of years since I got sick. And when I got a cold, the first thing I noticed was I've had this kind of like feeling in my body of I feel like I'm getting sick. And then, of course, the runny nose. That's the first thing I notice. Maybe like a cloudy sensation in my head, and then nasal congestion, a little bit of a scratchy throat. What else do I have? Scratchy throat. That develops into a cough in some cases, and depending on the type of cold virus, maybe some body aches or just a feeling of tiredness and weakness. Usually I don't get vomiting or diarrhea from a common cold, but I suppose it could happen because there's more than 200 types of cold viruses out there or more, and I don't think I've had every single one of them. But those are the pretty common symptoms of a common cold, and you know that because I know you've had it. If you've lived on planet Earth and you're more than 10 years old, you had a cold at some time. So there you have it, the rhinovirus, the most common, as far as we know, the most common respiratory infection in the world.